about non-communicable diseases. And for those of you that don't know, I'm a physician, gastroenterologist, but the issue of non-communicable diseases is becoming a lot more rampant, and something that we all need to be aware of. In Hosea, I think Hoover mentioned it earlier, that our people are destroyed for lack of knowledge. And as much as I was back and forth about this, it came to me that some people won't hear what I'm saying now unless we tell them. And so non-communicable diseases essentially are non-infectious conditions. So we all know about COVID, that's infectious. We're talking about the non-infectious diseases or the chronic diseases, and this includes diabetes, hypertension, heart disease. And the reason we're talking about this is because worldwide it's the biggest cause of death. COVID is the hype now, right? But diabetes, hypertension, stroke, these things are essentially killing our people. In Psalms, it tells us that we're given 70 years, right? 70 years. And these diseases are causing a lot of us to die younger than our 70 that we're allotted. 7 out of 10 Jamaicans, at least this was in a study from 2015, die from one of these diseases. And if these people aren't dying, then they have a lot of comorbidities from it. So somebody in here must know somebody who either had a stroke, a heart attack, or something. And the aim is to try to reduce the risk of these things happening. COVID-19 right now is having a significant impact on these non-communicable diseases because physical distancing, everybody's staying home, you're tending to seek help later than you normally would because you're staying at home. So yes, we say that if you feel sick, stay at home. That's if you have runny nose, stuffy nose. If you're having signs of a stroke or if you're having chest pain, that's not the time to stay home. A lot of people don't want to go to the hospital because they're afraid that they're going to catch COVID when they may die from the heart attack that they may get. So the aim is to not delay in seeking medical care. So let's start off with talking about hypertension. How many people know somebody with hypertension? Yeah, everybody. And the church part is finished, so we can talk. What is hypertension? High blood pressure, right? Everybody knows this is high blood pressure. And you will see or hear when you go to the doctor, they talk about these two numbers, 120 over 80 or 100 and whatever over a different number, right? And just so you know, these two numbers are relevant. And the top number, we call it the systolic blood pressure. You don't need to know these fancy names, but just so that you're aware. The top number is when the heart is pumping. So we get a number, that's the first number that the doctor records, that's the 120 or 180 if it's that high, over the bottom number, which is when the heart relaxes, right? And normally this is supposed to be less than 120 over 80. If it is that we're starting to get anything higher than that, then we refer to as having elevated blood pressure. When you get to 130 top numbers, then we start to say that you now have high blood pressure, right? And at that point, it can mostly be controlled with diet and exercise. Once you start to get over 140, over 90, that's when you start needing medication and that sort of thing. And definitely if you have numbers in the 160s, 180s range, then you're towards the risk of heart attack, stroke. I just wanted to mention ambulatory blood pressure monitoring because ideally, if it is that you were to check your blood pressure throughout the entire day, that would give you a more accurate reading, right? We talk about, Instagram, Facebook, these things are the hype now, and when you look at these pages, essentially you will see a snapshot. If it is that you go to the doctor and you get a blood pressure reading, that is one snapshot at that particular period in time. I don't know what it is later on in the evening or in the night when you're sleeping. And so they do have ambulatory blood pressure monitoring where you can get continuous monitoring. Outside of that, if you actually do have a machine, which I hope anybody of you in here with hypertension actually has a machine, you can check it multiple times throughout the day to give you a better idea, right? Or blood pressures in the daytime also tends to be different than in the night, right? And it's higher in the day, more active, etc., than at night, more relaxed. So you may have lower pressures of 110, 65. You hear me? Yes. Tell me some of the risk factors of hypertension. Anybody? Overweight. Overweight, yes. Somebody with this side. Anybody? Well, it can lead to stroke, but the risk factors is things that increase your chance of getting it. So you get the hypertension and then you get the stroke. But if you're overweight, if you have diabetes, family history, right? Diet. And I like that. Diet, very important. So the risk factors essentially, is unhealthy diet, low physical activity, drinking. I don't think many of us in here will have that issue, but excessive drinking, smoking, right? Family history, gender, some will cemented to have higher risk as well. These things can eventually lead to high blood pressure. And then tell me some of the symptoms. Headache, yes. Dizziness, very good. Okay, y'all are stars. So the symptoms, severe headache and vision problems, right? They'll talk about chest pain as well, blood in the urine, and the blood in the urine is because if you have high blood pressure, it can damage the kidneys, and then that can lead to issues as well. So if you see any of these factors, then you essentially go and seek healthcare, right? And then Prima mentioned stroke. So the complications include stroke and heart attack. And the reason that this is happening is because the blood vessel is essentially like a pipe or a hollow tube, right? And if you have your pipe at home, it's supposed to allow the water to flow. But if there's a lot of gunk in it, sometimes you have to put drainer down it to clear it. If there's a lot of gunk in it, and we refer to that as plaque in the blood vessels, then it reduces the amount of blood that can flow to the tissues, right? So if you don't have enough blood flow into the brain, then you get a stroke. If you don't have enough blood flow into the heart, then you get a heart attack. If you don't have enough blood going to the legs, then you go on the peripheral vascular disease. But anyway, then you can get like pain in the legs as well, right? Or you look at some people and they'll have dark legs. You know, up here is light and the legs down there is dark, and they'll say poor circulation, right? And this is because you have this plaque building up in the legs. And I mentioned the kidney failure as well, right? So it's important for all of us to be screened. And who is to be screened? Not just the old, right? Anybody, essentially at least to start over 18. For the kids, the younger ones, when you go for your regular checkup, etc., your doctor will also check, right? Because it's not that kids can't get high blood pressure. And it's increasing now in any minute. But definitely all individuals over 18 should be screened at minimum annually. Now, if you have some of these risk factors, overweight, you know that you're eating poorly, you're not active, that sort of thing. If you know that you're at risk, then you need to be getting checked twice a year at least. Any questions about hypertension before I move on to diabetes? So diabetes, what is diabetes? Anyone? Sugar, all right, yeah, perfect. High sugar, not just sugar, but high sugar, right? And essentially a disorder that disrupts the way that your body uses the sugar. All the cells in our body, we need sugar to work. And in order for the sugar to work, it has to be able to get into the cells. So you eat, etc., the sugar is absorbed into the blood vessels, and then you need to have the insulin in the system, which kind of acts as the key to open the cell to get the sugar into the cell. Understand that? Yeah. Insulin is the key to get the sugar into the cell. So if you have no insulin or a little bit of insulin, you have diabetes and that key isn't working properly, and so the cells won't be able to utilize the sugar right? And then it ends up with high sugar in the blood, aka diabetes. And you have two types. Not that you need to know the details about it, but just to be aware, you know that some people have diabetes and they have to take insulin. Some people have diabetes and they just take tablets, right? And it depends on which kind of diabetes you have. But type 2 diabetes, those patients usually take tablets. However, if it's really bad, they might end up to where they need insulin. Symptoms of diabetes now. Anybody? You must know somebody right? Huh? Tiredness, yes. Right. So fatigue, excessive thirst, always hungry. And poor mood eating is another one that a lot of people don't think about. But if you have diabetes, you get a little cuts that normally would heal up in a week or so, and you realize months now you still have this ulcer on your foot and you wonder why you can't. You need to get checked for diabetes. It can also affect the eyes, so you may get blurred vision, etc. And in terms of figuring out if you have diabetes, once you have the symptoms or once you're even concerned, once you're in the age bracket, you also need to go and get checked and you do have blood tests, right? And then I won't get into the nitty-gritty of the numbers, but essentially when you do the blood test, depending on how high the sugar level is, it will say yes you have diabetes or you may have pre-diabetes. It's important also to know if you have pre-diabetes because you can at least try to fix some things before you end up at diabetes, right? It says on the thing that says A1C. A lot of people don't know very much about it, but if you have diabetes in here, and I won't ask you to raise your hand, but if you do have diabetes, you should know what your hemoglobin A1C is, and that value gives you an idea of your sugar control for a 3-month period. I talk about the Facebook, Instagram snapshot thing. When you go to the lab and you get tested, that just gives you your glucose at that time, right? The hemoglobin A1C tells you how you've been for the last 3 months, right? So if it's greater than 6.5, that tells you that you have diabetes, but if you do have diabetes, you want to at least ensure that you keep that value around 7 or less than 7. Complication of diabetes, similar, stroke, hypertension, eye problems. We talk about diabetic foot, that's if you end up with the ulcer, right? And get kidney problems. Anybody know somebody on dialysis? No. You know, I mean, dialysis now is where the kidneys aren't working, and essentially now you have to go and get attached to a machine for them to take out your blood, clean it up, and put it back in, right? And that's something that they have to live with 2-3 times a week. It's not fun. So essentially try to avoid kidney problems with diabetes. And then we spoke of diabetes, we spoke of hypertension, but for those that have diabetes and hypertension now, the risks of these things is even greater, right? 40 to 80% of diabetics will have hypertension. 40 to 80% of diabetics will have hypertension. So try to avoid getting diabetes or hypertension. It increases your risks. You're 2 times more likely. This diagram also says you're 2 times higher risk of getting a stroke, 3 times higher risk of getting heart problems, right? 2 to 4 times higher risk of getting the peripheral vascular disease, the leg issue that I was referring to. And that brings me to cardiovascular disease. Cardiovascular disease, a medical fancy term for heart problems, but not just heart problems, but also the blood vessels are also involved, right? And essentially it happens because of that buildup of plaque or atherosclerosis that happens in the blood vessels. It actually accounts for 30% of deaths in Jamaica, right? And there are modifiable and non-modifiable risk factors that we can look out for. What I mean by that? Essentially, some of the things we spoke about, diet, exercise, etc., those things we can change. And that's why I'm here. Essentially, for us to change the things that you can change. You can't change who your family is. You can't change the fact that your mother had diabetes and so you're at risk to get diabetes, but you can change the other things, right? Ethnicity, again, is another non-modifiable risk factor, and all of us in here, I believe, are blacks or Asian or something. Yeah, close enough. Also at higher risk, right? Of non-whites at higher risk of getting it, right? And again, you can't change the color of our skin, you can't change your gender, but you can change your weight, the risk smoking. As I said, I know that none of us really have that issue. I also want to point out the psychosocial factors. Stress. Right now we're in the middle of a pandemic, people are stressed, people are losing their jobs, people are wondering how they're going to support their family, etc. Right? And stress can also increase your risk of getting high blood pressure and that sort of thing. The next diagram essentially is just another pictorial that shows you the fact that if you have that plaque in the blood vessels, blood won't flow, and if that completely blocks off, then you end up with higher problems. And so we need to manage the complications of heart disease to prevent the visual loss. It was mentioned in the media earlier, last week I think, I don't know if any of you heard it, but Roger Spencer had a stroke and is in hospital with a stroke, right? So this thing has no rhyme or reason, doesn't choose who and who is going to get it, right? All of us are at risk, and it's important to know. There are two types of stroke though. You have an ischemic stroke, fancy name, don't worry about it. Essentially you just get tissue damage, or you have a hemorrhagic stroke where you can bleed in the brain. And it's important to know because the management of each is different. It's not just like, okay, you have a stroke. About 2 or 3 weeks ago, I heard somebody say, okay, yes, they were taking care of somebody at home and it looks like their face twisted and I think they had a stroke, but we never went to the hospital because of COVID, right? A week later, that person died. And essentially, guys, yes, COVID is there, COVID is there. We all need to be safe, etc., but we also have to be sensible about what we're doing as well, right? So if you think you have a stroke, if there are symptoms of a stroke, please see medical attention. We have to manage your blood pressure, you might have to get fluids, we need to get a scan to see what kind of stroke you have so we can know what kind of management you need, right? So how are we going to prevent heart disease and stroke? We talk about knowing your risks, and now everybody knows your risks. If you didn't know before, now you know. There's also a calculator for the younger ones who are savvy with the internet, right? You can go to heart.org and actually calculate what your risk is based on your age, your weight, your risk factors. You also want to ensure that you're eating a healthy diet, right? It's easy to just go and pick up some Burger King, some KFC, right? You can't do that every day. Even if you're young, you have to start from now because you won't, trust me, you won't be young forever. I thought I'd be young forever, but that's. You also have to be physically active, right? And I mean, we're taught to tell you 30 minutes a day of exercise. That's the bare minimum, guys, bare minimum. 30 minutes a day of exercise, but if you're exercising for 30 minutes a day and you're eating 4,000 calories of nonsense, right, you're still going to end up in problems. So you have to essentially try to balance everything. You want to watch your weight and you manage your condition. So some of us will still get hypertension, will still get diabetes. It's not the end of the world, it can be controlled. And essentially, you just need to follow up and not only follow up with your doctor, but follow up with yourself. You have to take control of your own condition. If you have diabetes, you need to have a machine at home where you're checking your own sugar and you're watching what you eat. You're going to see the doctor maybe 4 times for the year if you're lucky, right? But it's something that has to be managed every day. So you take your medication, and if you need help, seek help. All of us here is a family, as I said at the beginning. I need you, you need me, etc. And so seek help, a church, your friend, etc. if it is that you need support. Obesity now is a global epidemic. We talk about coronavirus being a pandemic. Yes, obesity is also another major issue. And a lot of us don't know what our body mass index is, or BMI. And And essentially, again, an easy calculator that you put in based on your weight and your height to know whether or not you are normal, overweight, or obese. You need to at least know so that you can try to fix it. In that picture, you have an apple, you have a donut. Which one should you eat? Donut. Who said donut? Who said donut? So you eat the apple. You choose the apple. Now and again, you might choose a donut or half of a donut, that sort of thing, but you choose the apple, right? 4 out of 10 men in Jamaica are overweight or obese, and 6 out of 10 women face the same problem. Okay, so on that bread, 6 out of 10 of us in here are overweight, right? As Teresa is counting the 6 people. But some of us will be overweight, right? And so essentially we already are at increased risk of everything that we spoke about, right? 1 Corinthians 6 tells us that our body is the temple of God. And so we have to watch what we put in it. Okay? And today is Sunday. In Jamaica, everybody's Sunday dinner when you go home, right? Sunday dinner usually tends to be a little bit bigger than, or much bigger than the dinner in the rest of the week, right? We have to watch portion sizes. The pasta and the meatballs, that looks amazing, but you can't have a whole big giant plate of pasta and meatballs. And I'm saying not to eat it because you're still going to eat these things, right? But it's just to watch the portion sizes. The curry goat and the rice and the vegetables, wonderful. But watch the portion sizes. If you look at the diagram in the middle, it shows you half of the plate is supposed to be vegetables, guys. Not half of the plate is rice. I'll just repeat that. Half of the plate is vegetables. Vegetables. Half of the plate. Normally there's like a little spoon of vegetables somewhere in the corner. There's like 3/4 of the rice and then a little bit of the meat on the side, right? So look at the, and holy for gravy, yes, that's a good point, right? Because the gravy is not too good anymore. So half of the plate vegetables, and then the other half of the plate, now you divide that into the rice or the starch, right? If it's the pasta, and the other part is the protein. I put up that picture of the nuts. Because who likes nuts? Yeah, everybody likes nuts, and they say nuts are healthy, right? The doctor tells you that nuts are healthy. I tell you that nuts are healthy. But you also have to watch the amount that you eat, right? Just recently, honestly, to be honest with you, since this COVID time that I started looking more into health and watching what we eat at home too and that sort of thing. And when you actually read it, anybody here read labels of the foods? Yeah. I only started reading labels recently. But when you read the label, you see that little handful of the cashew that is there, that is like one serving size. One serving. So when they say eat nuts, that is the amount of nuts, right? Most of us who like nuts just sit watching TV and you have it and you pour it out and you eat and you finish and you pour it some more and you eat and and then the thing finish and you have to buy another one, right? But that little handful there can have anywhere from 200 to 300 calories, right? And if you're supposed to be eating, honestly, like 2,000 calories, that alone kind of fills up a lot, right? So you have to watch the amount of what you eat. I don't know if it's a Jamaican saying, but there's a saying that anything too good is not. Anything good for you, not good. Yeah, like you mustn't eat. I'm saying you mustn't eat too much, even though it's good for you. That's it. That's it. Very good. Too much of nothing not good for you. All right, and then again to choose what it is that you're eating. The canned stuff is very high in sodium. Sodium is salt, right? So if you're going to have a can of soup or anything that is in a can, just know that in order for it to be in that can, they have to put a lot of sodium in it to preserve it, right? sodium so much will lead to pressure. I'm not saying that you're not to have any of these things, right? Just watch the amount. The corned beef, that was another eye opener. The tin of corned beef, guys. When you look at the tin of corned beef that normally you just drop it in the pan and take and eat with some rice, season it up and it's nice. That one tin of corned beef has in about 8 servings, am I right? Or 5 servings. 5 servings of corned beef is in it, right? So when you actually share out that amount, it's a small amount of corned beef out of the tin that you're supposed to eat. As I say, I'm not saying not to eat these things. Just look, start reading the serving size. Actually, I have to get a scale. I'm not telling you have to get a scale, but just if it's a 5 servings, that means you have to divide the amount of corned beef into 5 guys and not eat all of it. Right? And then, anybody have a scale at home? Right. Okay. I don't want to know how much you weigh, as long as you know how much you weigh. Go on the scale intermittently, and I don't want you to obsess about it either. Right? Don't go on the scale and oh Lord, I gained 1. Right? But at least like once a week, you need to keep a diary of these things. Keep a diary and know that okay, last week I was X. Why is it now that I am X plus 2? Right? And then you can look back and say, you know what, I had this and I had that and whatever, maybe I need to cut down. And exercise. It's hard to exercise because of work or whatever. And yes, guys, we stay home, but you can still exercise. Watch a YouTube exercise video, whatever it is. If there's a park where a lot of people are not there or whatever, you can run around the park, run up a hill, whatever it is that you choose to do, try and exercise. And if you can exercise past the 30 minutes, that's even better, right? Any questions about diabetes, hypertension, heart, stroke? Cancer is the other thing that I wanted to point out. I was over there some weeks ago and I told you guys that I had found a lump in my breast, right? Anybody can find these things. We are all at risk of these things. A small lump can lead to a big lump, and these things can develop to cancer. So you have to, for the women in here, right, examine yourself. Nobody is going to be examining you all the time. Sometimes you can go to the doctor and they won't examine your breast, right? You have to know that breast cancer is the leading cause, is the leading cancer among Jamaican women, followed by cervical cancer. And approximately 300 women in Jamaica die each year from this. It can be prevented. Again, that's the one reason I'm up here. You feel the lump, you go to the doctor, you get it taken out, right? Before it turns into something worse. And so we need to also get screened. And by screen, I mean get checked before it develops. After the age of 50, some of us in here are over 50, you should be getting your mammograms regularly, that sort of thing. For cervical cancer, you need to be getting your pap smear regularly, right? All of us in here, women, basically need to be getting your pap smears regularly. That's to find out if you have cervical cancer. And then some men will say, oh, I have prostate or prostrate. Anybody here? Anybody say they have prostate? Yeah. All men have a prostate, guys. All men have a prostate. But you can develop problems with the prostate. And that needs to be checked with a PSA, a simple blood test, you go and you get checked. Now, I'm not saying you have to go and do this and you have to go and do that. You can just go to the doctor one time and say, okay, I'm going to get all of these things done, you need to get these things checked. And then, I'm a gastroenterologist, so colon cancer is near and dear to my heart. Colon cancer can be prevented. There's no formal screening program, unfortunately, in Jamaica, right? But wisdom is the beginning of knowledge, that's the right? And so now you know. So even though there's not a screening program, you know that you need to go and get checked. Guidelines will say that over the age of 50, you either do a stool test or ideally you do a colonoscopy, right? We've been finding that younger and younger people. I was talking to a physician just this week and he said he has 20-year-olds with colon cancer. No, I've never seen 20-year-olds with colon cancer, but guys, it's out there, right? And so you need to be able to identify the signs because you might have it. And again, if you do a colonoscopy, colonoscopy and you find in the top left, you do a colonoscopy and you find a small polyp, the doctor can take it out at that time, right? The time that we can't take it out is when it reaches to that thing at the bottom, the big mass there, right? So the point is to find it when it's small so that you can take it out before it ends up to be a big problem. There are other alternatives to it. You can do a specialized CT scan, but the gold standard really is a full colonoscopy. Anybody here watch Black Panther? I thought it was like a lot more people than that. Anyway, Chadwick Boseman died recently, right? He was a star of Black Panther, and he died from colon cancer, and he's 43. So again, important to know, you look out for weight loss, unexplained weight loss, blood in your stool, and I say unexplained, let me stress that out. Unexplained, I'm not saying if you exercise and you're eating right, you change your diet and you're losing weight, that don't mean you have cancer, right? That's normal. But if you're not doing anything and you realize you're losing weight, right, you want to check for colon cancer, constipation, changing color of your stool, painful, if you're having a lot of pain to pass your stool, you need to also go and get checked to make sure that there's nothing with your colon, right? And I'm gonna hurry so you guys can get home. But COVID now and these NCBs. As of 12 a.m. this morning, guys, there were 32 deaths from corona and 3,000 plus cases. We need to be aware of. While we're in here, I know that we social distancing and that sort of thing, right? When you go outside, you have to make sure that you're doing the same, because you don't know when you go outside, the person that's beside you don't know what they were doing or who they were in contact with, right? I'm just reminding you about it. 40% of the people who have been hospitalized with COVID had heart disease or stroke. So the diseases we spoke about at the beginning, it increases your risk of demise from COVID. Getting COVID is not a death sentence. If one of you have COVID, you're going to pray for you, you're going to do what you need to do, etc. You can pull through, right? But if you have obesity, diabetes, hypertension, etc., it increases the chance of you having a harder time to get through it, right? And so we just continue doing what was said, social distancing, wearing a mask. And then wearing the mask, I should just point out, I see a lot of you guys doing it. You know, like when we're in church and we need to pull it down, whether to sing or whatever, the germs are on the outside of the mask. So if it is that you're going to be pulling down the mask, try not to touch the middle of the mask to pull it down. You pull down either the side or something, because after that, after you touch this, and the kids do it a lot, after you touch this, then you're going to touch your face or touch something else, right? You're going to eat, etc. and cause it to spread. I think it was last week too, the JMDA president, that's the Jamaica Medical Doctors Association president, was on the news, and essentially they've been saying that now they're seeing that a lot more people are coming into hospital with issues with the diabetes, the hypertension, because since March, everybody has been staying home, right? So you have an appointment to go to, and you decide that you're going to not go to clinic because COVID, right? And then later on now, we're seeing that a lot of these patients are showing up with harder to manage issues, right? The Bible tells us in 2 Timothy that God has not given us a spirit of fear, right guys? So COVID is there, we don't have to be afraid of COVID, it's just to make the necessary changes that you need, right? This now everybody knows, avoid, wash your hands regularly, use the hand sanitizer, right? And in here I see that we're doing very well. I don't know what's happening outside, but in here we're doing very well. And think about your mental health as well. A lot of people, and again I talk about social support and all of us in here being a family, reach out to somebody if it is that you're having problems. Some people are at home, right now I'm at home, I have Crystal, I have Alex, and I'm busy, right? Some people are at home alone, and it can be depressing for some, right? So even though we said to isolate, whether it's a call, Prima was talking today about a WhatsApp group, just continue to stay in contact with people. break from social media and the news, right? Because, I mean, I never used to watch CNN, and from March it's CNN, and then now I come home and it's news, right? But then, you know, it's like, oh gosh, 10 more people there, oh gosh, this, whatever. So sometimes take a mental break from it to kind of just see. According to the World Health Organization, these NCDs, or non-communicable diseases, that's the diabetes, the hypertension, not the corona, it's the diabetes, the hypertension, the stroke, those things account for 80% of deaths in Jamaica. And so, please try to control it if you have it, prevent it if you don't. The prevention and control of these are crucial in the COVID-19 response, because again, if you have these things, it's harder to fight COVID. And prevention is better than cure, that's what they say in Jamaica, right? The end. Nobody has any questions?
What about high cholesterol?
What about it? Yeah, high cholesterol is definitely a risk, right? It will be a risk factor to develop all of these things. And the high cholesterol, you see in the pictures when they had that yellow deposit on the blood vessels, the cholesterol, the plaque will make that thing pick up and then narrow the blood vessels and then cause more problems.
How do you prevent?
Try and pull it down on the side.
How do you prevent plaque buildup? And how can you get it?
Okay, so preventing it is what we talk about. Because when it's there, it's pretty much there. To prevent it, you eat right, exercise, you ensure that your cholesterol isn't high, right? That sort of thing. If you have diabetes, you control it, because let's talk about high blood pressure. If you have high blood pressure, imagine you're trying to push liquid, which is the blood, through a blood vessel that is partially blocked, right? Partially damaged from the cholesterol and stuff that is there. And with this pressure, it damages it. Every time you get damaged, you know, when you get a cut and it heals and you get a scar, right? The same thing happens in the inside of the blood vessel. So you get a scar and then the plaque gets bigger. You get a scar again and the plaque gets bigger, right? And the question was, how do you get it removed? It's not like, unfortunately, it's not like Drano or a tablet or something that we can just take that's gonna remove it. But there's medication that they can put you on that has been shown to break it down a bit. And if it is that it's blocked, like if you have a heart attack, for instance, and it's blocked, you go into the hospital, they do a procedure and open it up with a balloon. And essentially remove it at that time, right? But the problem is you will open up that vessel that is blocked. So this thing that's happening is happening all throughout the body, right? And they can't go and open every vessel. So they open the vessel that's mainly blocked. And so the aim is to prevent it from getting there in the first place. One second. On respiratory disease, yes. So I never addressed that because of time, but respiratory diseases are also one of the NCDs, some of the NCDs, right? There's a host of NCDs. So like asthma, right? Asthma is Alex has asthma. People in here have asthma, okay. So with asthma, essentially you have narrowing of the airways, right? And so people, you walk in, essentially you get short of breath, right? And that's because the airways tend to be narrower than everybody else. It's harder to necessarily prevent that. It's controlled with, you see people walking around with a pump, right? Or a Ventolin pump, or bronchodilator is what it's called, essentially to help open up the airways. And the general things in terms of diet and exercise. Exercise will help to improve your lung function, essentially. That will also help controlling asthma. Asthma, just like diabetes, can be controlled. Some people need 1 pump, some people need 2 pumps, right? But it can be controlled. There's tablets as well that can help. And essentially, all of these things are just open those areas.
Speak to the issue of breast cancer as it relates to food, but it did not speak up as it relates to weight.
Correct. I did not. There's a lot of things I didn't speak on, but that's a very good point. Thank you. I don't want to say it's 5%, but I look at it, it's lower in men, but the chance of breast cancer is also there. So you also examine yourself as well. It's between 1 and 5% of men that can get breast cancer. So very good point. Thank you. Men can get breast cancer, especially if you're overweight and you have bigger breasts than a regular person, then higher chance. Thank you. All right. Thank you, guys.
Thank you.